I knew this was, I remember him saying this. Remember? I know this. I knew he said this. I told you he said
We will keep this promise to the American people. If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period.
Yes, I knew it. I knew it. I knew he said that. I knew he promised that. Matter of fact, even when they got ready to pass this bill, the Obamacare bill, even with the microchip in there, I know the microchip's in there, in that bill, HR 3590 and HR 4872, the microchip in the right hand, the forehead, the identification. I know. The registry, the identification registry. And they were supposed to get that. We're supposed to get that so that they can identify you. It's the microchip. It's in there. But I'm glad that the president promised us. He promised us. If you like your doctor, you can keep your doctor, period. You like your health care plan, you can keep that plan, period. Well, I also remember what Nancy Pelosi said. Remember?
But we have to pass the bill so that you can find out what is in it away from the fog of the controversy.
Right. I mean, let's not have any misunderstanding. All this fog of the controversy about this bill. It's very clear. The president said, if you want to keep the plan you got, you can keep it. And if you don't want to, you don't have to be a part of this Obamacare bill. And they don't like to call it Obamacare bill. They like to call it the Affordable Care Act. Well, Stephen Adams has sent me the breaking information. Nancy, now that we've passed the bill, let me tell you what's in it.
But we have to pass the bill so that you can find out what is in it away from the fog of the controversy.
Okay, Nancy. Thank you so much. We'll do that, all right? Here's what it is. I want to thank Stephen Adams for this report. But according to NBC News, the Obama administration knew that millions of people could not keep their health care insurance. President Barack Hussein Obama repeatedly assured the Americans that after the Affordable Care Act became law, people who liked their health insurance would be able to keep it. But millions of Americans are getting or are about to get canceled. They're going to get these letters in the mail from their health insurance providers under the Obamacare bill, saying experts are saying that the Obama administration has known this for at least 3 years. 4 sources deeply involved in the Affordable Care Act tells NBC News that 50 to 75% of the 14 million people who have their own health insurance individual plans can expect to receive a cancellation letter in the mail or equivalent over the next year. Folks, already millions of them already have. And actually it's going to be around 80% of every person who has their own paid for individual plan is going to get canceled. They don't even get they're just done. They don't get to keep their doctor. They don't get to keep their plan. Instead, they have to get involved in the exchange. And if they want to stay in the free market, they can expect to pay twice as much, and it may be 3 times as much as what they've already been paying for less coverage. The sticker shock is getting ready to hit you. Don't worry about the website. The fact that that's a fiasco and it's cost American taxpayers $300 million for something that don't work. Don't even worry about that. That's the least of your problems. When they do get it fixed and you find out what your new health insurance plan is going to cost you, you're going to fall off your chair. You're going to say, this can't be right. Less coverage for double or triple the price? What? No. I mean, come on, Mr. President. That is not what we elected you. So let me give you, everybody calm down. Nancy Pelosi, you calm down. Let's review what the president said Several.
But we have to pass the bill so that you can find out what is in it away from the fog of the controversy.
The fog is what's coming out of the Obama administration camp, what's coming out of Congress during that time that they ramrodded, that they force-fed this Obamacare bill down the throats of the American taxpayer. Let's be brutally honest. That's the fog. It's not Ted Cruz who was fighting against it. It's not any of the other lawmakers that were trying to stand up against it. It's the bill itself. It's an atrocity. And oh, by the way, there is microchip implantation in the bill. And I gave you guys a video on this over 18 months ago. I told you what was coming. That in the bill, it was already in the bill. The bill, first of all, started out 2,200 pages. Now it's over 5,000 pages because they got to keep putting more pages into the bill because we have to figure out how to implement what it is we said we just passed. So Nancy Pelosi, when she says we got to pass the bill to see what's in it, she is basically telling you the truth. They didn't know what in the world they were passing. Or did they? Now, the President of the United States told us, don't worry about it. It's the Affordable Care Act. Everything's going to be fine. You're going to get to keep whatever insurance plan you have. Nobody's going to make you cancel it. Well, ladies and gentlemen, I'm going to play for you several campaign speeches, and I'm also including a State of the Union address where he guarantees you, the American taxpayer, that you don't have to worry about this. Everything's going to be okay. You can keep your doctor. You can keep your plan. Now, with all due respect, everyone, please pay close attention to the Commander-in-Chief, to the President of the United States.
We will keep this promise to the American people. If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period. First of all, if you've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan. Nobody is talking about taking that away from you. No matter what you've heard, if you like your doctor or health care plan, you can keep it. If you like your doctor, you can keep your doctor. If you like your private health insurance plan, you can keep your plan, period. If you are among the hundreds of millions of Americans who already have health insurance through your job, or Medicare, or Medicaid, or the VA, nothing in this plan will require you or your employer to change the coverage of the doctor you have. Let me repeat this. Nothing in our plan requires you to change what you have. Our approach would preserve the right of Americans who have insurance to keep their doctor and their plan.
Okay, so there you go. How many times did he say it? How many times did he say it? Including one of those times, September, it was at the State of the Union address on January, I forgot what it was, in 2009. How many times did they say it? How many times did he say it? Well, the truth is, it's absolutely not true. You can't keep your doctor. You can't keep your plan. You're going to be forced into a new doctor and a new plan. And if you are part of the Obamacare system, you are going to pay higher deductibles, higher premiums, lower benefits. And even your new insurance programs, if you can get any, because most employers can't afford it. They can't afford the Affordable Care Act. They can't afford it. So what's going to happen is you're going to pay double, maybe triple your premiums for lower the coverage. And yes, there's death panels. Yes. What I mean by that is, and what Sarah Palin meant by that was simply a team of bureaucrats will decide the grid and who will qualify for hip replacements, knee replacements, liver transplants. Are you too old? Are you too sick? Do you not have enough money? Actually, when you try to sign up for Obamacare, and I already did a video on this where I actually call Obamacare and on the phone try to find out how I can can you give me the price it's going to cost me? He said, we can't give you the price. You have to give us your name, your address, your zip code, how much money you have, your earnings, your health history, your medications, and then we can put you into the grid, and in 24 hours it'll kick you out a quote. In other words, not everybody gets the same price. Not everybody gets the same quote. And it's based on a lot of factors. And you're forced into this plan. So you're going to lose the plan that you chose, and you're going to be forced to take a different plan, and you will have to pay that price. And if you don't like it, well, then you can pay the penalty, the tax penalty at the end of the year. So this is a tax on the poor. Oh, by the way, if you're working a very low income job, 40 hours a week, flipping burgers at McDonald's, or maybe working at Wendy's, or maybe you're at Steak and Shake or some other fast food place, or you're a CNA in a nursing home, or maybe you're working at Walmart as a greeter, you're probably going to get your hours cut to 29 hours a week instead of 40, because your employer cannot afford to provide you with this Affordable Care Act. So you will not even be eligible for anything. You can't even get it. So then you're going to be forced to have to buy the Obamacare health care. And when you go to pay for it, it will be higher than you thought, and you will get less benefits than you expected. Plus, you're only getting 29 hours a week now in your job instead of 40. The kids still need shoes. The rent's still got to be paid. And you're mandated to do this, or you will be taxed on your tax return. And a small family of 4, let's say, a man and wife, 2 small children, well, you're going to be taxed $1,500 if you don't go get some health care, even though your hours have been cut and the premiums are higher than you can afford. Welcome to Obamacare. Oh, and by the way, by December 31st, 2017, every American citizen is required to have a microchip in their body, and that microchip will contain your identification registry. It's a Class 3 implantable device. It's right in the Obamacare bill. There's a Class 2 microchip, which has to do with chin implants, pain pumps, pacemakers, breast implants, different types of procedures. There will be a microchip in every one of those implants. That's called a Class 2 Class 2 implantable microchip, just so they can, it's like a serial number on the product. But you're also going to have a microchip at some point here that will have your bank account, and it's a GPS, and it's your birth records and your social security number, and your your personal identification numbers, and your medical history, and your prescription drug history, and everything they need to know in case you get in a car accident and they wheel you into an emergency room. They don't know who you are. They can just and then you're there. Okay, so this is in the bill now. It was supposed to have already been implemented, but of course they pushed that out to the end of 2017. So I'm just saying, Nancy Pelosi, actually President Obama was not telling the truth when he said you could get to keep your plan. That flat out's not true. And Pelosi was actually telling the truth when she said we got to pass the bill to find out what's in it, because we didn't know.
But we have to pass the bill so that you can find out what is in it, away from the fog of the controversy.
So what I've decided to do is I'm going to call the Chancellor of Germany. I'm going to call Angela Merkel and see if she can tell me what's in the Obamacare bill, because nobody here can tell me. And she might be so upset about the fact that her telephone has been wiretapped and listened to, she might let us know what's the next thing they're going to do next. I don't know. Nobody else will tell us. We can't get any truth out of Congress. We can't get any truth out of anywhere. These are the facts. You see why we have to pray for America? I'm serious when I say that. I know I took a lot of heat for doing that video about the microchip in the Obamacare bill. It's my #1 watched video, but here we are today. What do you want me to do? I told you. It's going to get worse, too.